Hi, I'm Amy Thomas, and I stopped into one of my favorite pharmacies today to meet with the owner, Anderson Jolly. Hi, Andy.
Hi, Amy. How are you?
I'm doing fantastic. Thank you for letting me come
Well,
here today.
it's a pleasure to welcome you here. You know, we've known each other for so many years, and you've been one of our customers. It's always a pleasure to have you stop by.
Well, I really appreciate ReadyMeds Pharmacy. I remember when we first met, and I was using a different pharmacy, a mom and pop pharmacy. And it was so funny because Andy was like, come look at my product, come look at my product. And I was like, no, Andy, I don't want to switch. Change is hard. And then there I came.
Hey, you know.
And I was your customer for over a decade. It was phenomenal. Yes,
Good,
it was
good.
awesome. I really appreciate your guys' customer service.
Good.
So I was hoping to come by today so that we could discuss kind of how the processes work, how ReadyMeds benefits the community.
Well, hey, you know, we've designed a pharmacy that is geared primarily towards the adult family home community. So let me know what's on your mind.
That's fantastic. I think that a great place to start would be starting with the new admit process.
Oh, that's
So if we're admitting a client into the home and we want them to come in, what is it that we should do? What would be our best practices, the things we need to do? How can we help you help us?
Well, what we did is that we designed a new admit process that is really geared towards safety of the clients. We have a new admit form. The new client form is one that needs to be filled out as soon as a customer determines that they're getting arrested. We want to make sure that that form is filled out immediately and get that into the pharmacy. We also want to make sure that you have a med recon list. Now, a lot of people don't understand that because they're like, hey, I have prescriptions here. But the whole idea is to make sure that we have all the prescriptions ready as soon as that's ready to package and ready to go out. As you know, we do the salad packs or the multi-packs, and that contains all the medications for the client. So we want to make sure that that process is as complete as possible. We want to make sure that we do it right the first time and make sure that the customer is safe, and we make sure that your adult family home is in full compliance once you get that customer.
Excellent. So a med reconciliation list. Typically I would get that from their primary care physician.
Usually.
But if they're in a hospital situation, how would we be handling that?
Well, you should get it from the hospital as well. Keep in mind that that patient's coming out, so somebody is going to validate that they have had all these meds listed for them. And we want to make sure that we include prescription meds, OTCs, as well as any non-drug orders on that list, because we want to include that in your mark to make sure that your caregivers are following those orders to the T. We want to make sure that everything is listed for you clearly. Not only that, keep in mind, the adult family home needs an order in order for them to dispense or to give any care to their patients.
Okay.
So getting that at the get-go really makes a difference for your customer.
Fantastic, fantastic. So if I needed to get the new client forms, the NCFs, where would I be getting those for the clientele?
Oh, very easy. Right on our website, readymedspharmacy.com. If you also want, you can call the pharmacy. We're happy to fax it out to you as well and get it to you, email it to you, whichever way we can get it to you. Those are accessible for you.
Okay. Something else that I've done with my clients and customers is that we've made a file folder in an email with all of the admission forms as well as the new client forms, and that also can be beneficial. Make sure that they're in the form of a PDF so that nothing can be changed or copied or switched around.
Yeah.
Fantastic. Okay, and so what should an adult family home provider do if a client is hospitalized for a long period of time? It's not just going to the emergency room, but they end up getting sick. They check into the emergency room and boom, they've got sepsis.
Well, you know, one of the things that most of our homes don't realize is that you want to make sure you take action immediately if there is a change in the client's condition. So any significant change, the fact that they were hospitalized either makes me think that something was obviously wrong. So what you want to make sure is that the facility sends the the pharmacy an updated list of everything that went on with them there. That way we can compare it to what we have already. You don't want to move your client back into the facility and just figure, hey, it's all the same from just as before. So you want to really make sure that we manage that change for you, or we manage that move for your client.
Interesting. You know, I find that leads me to, we're supposed to call the nurse delegator if they have nurse delegation. So in turn, we would be calling the pharmacy and
That's
giving
right.
them the after visit summary, faxing that into them
That is
with the
right.
information. That
And
makes a lot of sense.
Updating the negotiated care plan. Let's not forget about
Let's
that.
not forget about that.
Because
Yes.
as you know, their conditions may have increased, decreased,
Yes.
they may have gotten better, or they may have gotten worse.
And this will also lead to you in the future so that you can decide whether or not they need a significant change assessment. This will prompt those things. So I think that that's fantastic. Andy, thank you.
Hey, thank you.
How can an adult family home provider ensure medications are sent to their home without any delay?
Well, delays, it's something
I want it right now.
Well, yes, it's something that we've been working on, and we have it so that we have put pharmacies as close to the facilities as possible. But here it is. If you're gonna send us all the information, make sure that we have everything. Not only that, when you are taking in a new resident, communication is key. So make sure you stay in touch with us. Make sure we have a phone number that we can reach you easily. Also, make sure that you give the pharmacy time. Very frequently we have cases where things are either not covered or a prescription was written incorrectly, and then the pharmacist gets to clarify that. Keep in mind, just because we might be quick at what we do, that doesn't mean that the doctor's office or the hospital may get back to us immediately or even the same day. Make sure if your client's getting discharged, guess what? A good idea, probably get 15 to 30 days worth of medication, because sometimes their insurance may not be active, the family members may not be available. We want to make sure that all those things are in union. Again, keeping in mind, when these prescriptions go out with the number of new clients that we do per day, we want to make sure we do it once. We don't have to come back to your home and redo the entire process, or even worse, put the client in any danger.
Yeah. You know, it's interesting. There was a time that I called the pharmacy and I was like, hey, I've got this person discharging. They're being a new admit into my home. I need to get these medications prior to them moving in. They're, brittle diabetic, insulin dependent, right? And I was told, hey, you've got to wait till we know that they're actually going to be discharged.
That happens so often. A lot of people want to make sure that client's coming over. But what has happened in the past several times is that the medication did get delivered early and the client never showed up.
Oh.
Or even worse, the client went to a different facility, which makes it even harder because now you have to do it twice. So again, most clients coming from a facility are probably going to be good for just about 8 to 10 hours.
Okay.
So patience. Let's do it right the first time and get a good result out of this, and make sure that client has a smooth transition to your facility. There's no need to have things there in advance. I actually have seen orders change after the client has gotten to the facility, simply because the pharmacist called and the doctor said, hey, this order may not be as appropriate for this client as I thought it was when they were here. Maybe I should change it. Or in cases where the doctor prescribes things that the facility cannot use, and we're talking about things like glucagon, for instance.
Right.
The facility can't use that, so guess what? We have to change it to something else that they can use. So again, if we do it right the first time, we get a really great process.
Fantastic. Talking a little bit more about delays in processes. So let's say that it doesn't have anything to do with a hospitalization, but it's a medication change. A doctor changes a
Oh.
medication, because I've seen, you know, you get things from the PCP, the primary care physician, but now you've got the psychiatrist who's involved, and they're sending medications, and some are contraindicated.
That's true.
We switched doctors recently, or we went to a new home doctor from a PCP. What happens in those situations with delays?
Well, Amy,
What's a good way?
I'm gonna go a little further than what you said.
Okay.
Imagine all what you said, plus you also have polypharmacy, where that patient is actually filling prescriptions at multiple pharmacies.
Yeah.
Or maybe they even filled something different at a different hospital, at the hospital where they came from.
Yes.
So all these things need to be clarified. And the whole idea behind clarifying those things is making sure that your patient is safe. My job at the pharmacy is to keep your license on the wall. I want to make sure that we do a great job at it. And our pharmacists do take time to make sure that these things get clarified. We do fax the doctors. We have to follow whatever requirement the doctor has. If the doctor says send it via email, we send it via email. If the doctor says send it via fax, we send it via fax. If the doctor will take our call, we're happy to speak to them. But again, we're working with other people to make sure we get those things sorted out for you before they get there. It's very easy to get it done. It does take time.
Yeah, you know, it's interesting that you say that. There have been times where I've called the pharmacy or the pharmacist to request that they get an order refill for us.
Mhm.
What can I do as the provider to also help the pharmacy in that situation?
You know, I'm going to tell you, a lot of people don't understand the issues that are going on out there. The medical industry is struggling with staffing. And I'm going to tell you, it's not pharmacies that are struggling with staffing, it's the doctor's offices, it really is those medical offices, the hospitals. When we send refills to the doctor, the law states that we have to give them 48 to 72 hours to respond to us.
Okay.
So we can't really badger them like we would like to. I mean, obviously, all of us would like to take a big stick and go down there and make sure the physicians get it done right away. It really doesn't work that way in the medical system. We do our absolute best. However, I will tell everybody this, and this is from what I've learned going to the fundamentals of caregiving classes. We should always make sure if we have to do refills, we do them 3 days or even 5 days before that they are due. If we take a little bit of time ahead, we have to understand we're going to give them time to get back to us. So if you start on day 5 and you follow up on day 2, and probably by day 1 you really get to it, I think we can have success. It's just that the system takes a little while longer these days. COVID really put a dent in everything, and not to blame COVID, because a lot of people blame COVID for everything.
Yes, they do.
But here it is. We have to give providers time to make an accurate decision when it comes to medical decisions.
Absolutely, that makes sense. You know, it's interesting. So we've talked about delays in medications and how we can help, how you can help. Really, I think that the idea with providers is they get stressed out because of compliance. It's like, if I see that the order is written this day, I've got to give it to him this day. This has to happen. It must be. So I'm going to stress out. I'm going to figure out what's going on. Now, there is something that I noticed that ReadyMeds offers in a couple of your scenarios. When we're talking about refills specifically, I noticed that on the bingo cards, there's a green section.
Yes, it's
And-
a 7-day warning.
Yeah,
That-
and so I feel like that's a really good way.
That is a good way. It's 7 days. You know you need to start the reorder process. Most insurances, Amy, will actually cover a medication about 5 days before it's actually due.
Okay.
So that's not a problem. Payment by the insurance is 5 days ahead. The doctors will take about 48 to 72 hours to get back to us on any refill. So there's your 7-day window right there. The issue is really getting our caregivers to understand that same day refill service sometimes doesn't work. Now,
Right.
does it work? Sometimes, but not every time.
So there's something else that I notice when I go into homes.
Mhm.
There's this really amazing form that you send to providers.
That's the physician order forms.
Yes.
We send those out.
And these forms, I notice people are like, I don't know what to do with this.
You know,
They
we're
sit
one of
there
the only
and
pharmacies
blank.
that send that out, by the way. We're one of the very few pharmacies that send those out.
Yeah, I love this. And I think that what happens sometimes, Andy, is that when we're with a pharmacy, we don't really know the advantages that we have.
That's true.
We always think that, okay, well, we're required to keep a MAR, but we don't realize that's a courtesy that you guys offer to us.
That is true.
Right?
That is true.
We talk about, hey, I need to get a medication list. You guys are catering to adult family
and
homes
we're getting
to make
those
sure we're
medication
covering it.
lists. Yes.
So if I were a provider, I could take the list that I have that you've sent to me,
You could.
and I could have the doctor sign and date down here on
you
the bottom.
Definitely. You can fax the doctor this list for yourself
Mhm.
and get the doctor to sign and date. And this is an actual prescription order that the pharmacy can follow if the doctor would put a quantity on here or a number of times that we need to refill it.
Excellent. And is there like notes or things that I could stick in here to
Oh,
have,
yes.
say,
You-
request
you-
medication
you can,
review?
You can put as
Please
many
make sure
notes.
the list.
You can put as many notes as you want.
Okay.
Yes, and not only just notes, but keep in mind this gives the provider a space where if they have any additional prescriptions or instructions, non-drug orders, they can actually write those right in there for you, and that becomes an order for the facility as well. So we've provided these to all our homes, and if you use eMart, this is available in an eMart setting as well.
That's amazing.
You can actually print that out from your eMart and send that off to your prescriber and get that. The other nice thing is you can actually send this, Amy. Remember we talked about polypharmacy, polydoctors, all the stuff.
So many.
You can send this to all the patient's doctor, whether they have a cardiologist, a pulmonologist, or any otologist, and they can actually sign these, and you can keep these organized in your file folder.
That is a fantastic idea. Andy, thank you. Okay, so I got another one. Here we go. Curveball. Why do you require a medication list?
Well, the medication list just helps us complete everything that we're doing. Literally, it puts everything together, because what we have now is that we've connected and we have a meeting of the minds. The doctor office says, here's a list of the prescriptions the client is taking. The pharmacy says, okay, we feel that this is a complete list, everything matches up in our system, and then you or your nurse delegator and your licenser. Most people forget
And your licenser.
why we work at this. It's for your licenser, by the way.
It's for the clients. It's for the clients.
Really. But most people forget that we want to make sure that these people can see something complete, and we don't get a message back a week later saying, hey, guess what? This client was also supposed to be on a medication. Either it got lost in transmission, or we forgot to give it to the client from the doctor's office. So we want to make sure, again, that the client is safe.
And I really think that that's a fantastic point, Andy, because I know that when I go into homes and I've heard about inspections, because it's happening, here comes spring, guys, let's start cleaning up. The thing is that when they see a clean medication list and it's within the last few months and they're reviewing your MAR, that expedites, right? Makes everything go much more quickly.
You get
in
that
the process.
beautiful smile from your licensor,
Yes.
and literally it's a welcome in and a welcome out.
Yes. Okay, Andy, so I'm going to pick your brain one more time.
Wow.
We've talked about a lot of tough things, new admits with clients, having the family sign off on it, lots of different pharmacies and hands in the works, other people, how can we get ready meds to help us? Perfect. I think that one of the biggest things, though, is what if a medication isn't covered? We have folks who come into our adult family homes and they either don't have a power of attorney, they may have a protective payee, they may not. They may come from such an independent place that they want to continue to manage their things, but they think because they're on Medicaid, that Medicaid's going to pay for everything, that's the golden ticket.
That's true. And a lot of times, Amy, what we do behind the scenes is that we make it so that you, the client, doesn't have to even worry about that. So what the pharmacy will actually do is, if we have a medication that's not covered, we will exhaust all resources to make sure either we find alternatives or we fax the doctor. Very often that works. Now, in a few cases, it doesn't, simply because there's nothing else that you can change to that would possibly be covered by the insurance or by any other payee that we can give the client. So what we do in this case is that we call the adult family home, and we also contact the family as well, or if they have a payee, and find out whether it is this client's choice. Remember, the clients have the ultimate choice.
Right.
So a lot of times people call and say, well, why didn't you call the facility first? Because really and truly, it is the client's choice to say yes or no, whether they would like to choose this medication or pay for this medication or not. We will call the facility and let them know eventually what the outcome of it is, and let them know, hey, client's gonna pay for this, we're gonna send it, not a problem. However, if a client cannot pay for a medication, and if the home is not willing to pay for it, because we actually have some homes that say, send it, I'll pay for it,
Yep,
not a
I've
problem.
been one of
I
those.
love this client, I want to make sure that they get everything they need. But if none of these work, what we usually recommend to the facilities is we need to call the doctor and get a discontinue order for this.
Okay.
Simply because we do not want it on your MAR, we do not want any open orders. We want to make sure that that client has a very clean med list, that you have all the medications for this client, and there's nothing missing or no questions concerning his meds.
And I think that another good point here too, Andy, would be to get the case manager involved.
Yes.
When they're Medicaid, the facility can get a hold of the case manager.
Yes.
If this is an absolute medication where the doctor, the resident, the families are saying they must need this medication, then we can look to other resources, and that's what your case manager is for.
That is correct.
Well, Andy,
All right.
I
Hey.
really appreciate you letting me come by
Thank
today.
you. It was a pleasure.
I really enjoyed it, and thank you so much. Keep
Thank
up the
you.
good work. I'll see you again.
We try our best. Thank you.
Thank you.